But let's just talk about syphilis. And again, you'll notice that the guideline is not saying prevention of HIV. It's saying prevention of HIV and other communicable infections, and even includes listeriosis as well. Okay. And the important thing about syphilis is that it can be vertically transmitted, and we know what the dire consequences of congenital syphilis infection are. And the other thing is that it's something that can be treated and preventing the congenital infection. So every woman is tested at booking and repeat the test at 32 weeks if the test was negative. It says that in the first trimester, but if the test was negative at booking, then you'd repeat the test at 32 weeks. And then there's your RPR and TPHA. The guidance is that we know that your TPHA remains positive for life, and your RPR, the titer, decreases as you're treating the infection. Okay. And the guidance is that you need to do a confirmatory test. So if you're doing an RPR, you need a TPHA to confirm. If you're doing a TPHA, you need an RPR to confirm. And then the treatment is still the same. I know at some stage there were stockouts of PENG, but PENG is still the treatment of choice. And it's saying there that even for the baby, or erythromycin is not a reliable cure for syphilis. So we need to be using PENG. So the new guideline is saying that our family planning and our HIV services need to be integrated. Our postpartum services, which have largely focused on the infant, need to include the mother. Now we're talking about the mother-infant pair, not just the mother or the baby and the baby. It's the mother-infant pair. It's a promotion and protecting of breastfeeding, safe breastfeeding. Either mother was virally suppressed. If she's not suppressed, we're using extended prophylaxis for the baby. And then your antenatal care, the big change is the repeat testing during pregnancy, and counseling about dolutegravir, extensive counseling about dolutegravir, documenting in the clinical stationery about your counseling. Labor and delivery, you do a viral load during delivery, you're checking at day 3 to 6. If you don't have a viral load within 12 weeks of delivery, high-risk prophylaxis until you have a viral load less than 1,000. Okay. Thanks, everybody.